Our focus is persons living with disabilities and surviving this pandemic. Dr. Ruth Owusu, she's head of psychiatry units at the Komfo Teaching Hospital. She joins us via Zoom for a conversation. Doc, good morning. Thank you so much for your time. You have to unmute so we can hear you, ma'am.
Yeah, good morning, Mama V.
Hi.
And good morning to all your viewers.
Great. Good morning, and thank you so much. Thanks for also following the documentary yesterday. So just, a reaction after surviving a pandemic, the spotlight on persons living with disabilities.
It is really touching. I think that many people have not thought about persons living with disability. As I watched the documentary, one of the things I realized was that as a nation or as a people, we have not taken very good care of our vulnerable. And several research have proven that if there is any pandemic or if there is any big trauma for any group of people, and we need to get over it, we need to come out of it. One of the ways is to involve everybody. One of the ways is to take care of everybody, and that means that we take care of our vulnerables as well. I just threw my mind back and I realized that even simple things like Veronica buckets, I didn't see any of them that had been designed to suit the disabled or people living with disabilities. We thought about everybody else and did not think about them. There were some that came with pedal, there were some at various heights. What about those who were physically challenged and could not reach to where even the tap is? I realized that these little things have all not taken into consideration people living with disability. Have we thought about their economic survival? Most of these people attend schools of the blind or special needs schools and may not be able to join in virtual education and all that. So what happens? The period that we were all at home, most schools were doing virtual learning and all that. What happened to them? Did we take care of them? It brings back to forth to all of us that we have not taken care of the most vulnerable in the society in this pandemic, and we need to sit up as a people.
Some of them also talked about the psychological impacts that this all may be playing out, and we're just fortunate to hear from a few. How do you, from where you sit, are you able to analyze this situation?
So definitely, COVID has come with a lot of economic hardship, and people who are who have various disabilities or who are at high risk include people living with disability. And if there is any pandemic of this sort and you realize that you are in a high-risk group, it makes you even more anxious. You are likely to be more distressed. And so these group of people will certainly have heightened stress and heightened psychosocial distress. Now COVID comes with a lot of cost, medications, buying PPEs, your masks, your hand sanitizers, etc. And if you know that you are not economically stable or you are not economically able to get your day-to-day nose masks or face masks, for instance, then you know that you are at high risk. And that thought alone can make you anxious. That thought alone can put you through a lot of psychosocial and psychological distress.
Are we paying attention? I know that you've talked about how we may have neglected them. But have we deliberately made plans for them? And there was a person with the Federation for the Blind who talked about, I think he's an officer who's been chosen to coordinate issues with COVID-19. But have we done enough?
So like I said earlier, as a people, I don't think we have done enough at all. We need to sit up. If you have a person who is visually impaired, for instance, how definitely that person would need a lot of assistance moving around from place to place. If you have somebody who is physically disabled, they will need assistance moving from place to place. How do they factor in even social or physical distancing, for instance, and so most of the preventive protocols may not be fully applicable when it comes to people living with disability. And so what else do we have for them? I've been checking other nations, other countries, like the United States, and some of the measures they have put in place. If someone would have to hold on to you to walk some distance or to move from one place to the other, do you have access to consistent hand sanitizer? Do you have a Veronica bucket or a tap that has been placed at your level, or that you can be helped to get to, so that you can wash your hands or sanitize your hands as often as possible? If you are physically impaired, like I said, do you have taps that get to your level, that get to your height, so that you can actually wash your hands? If you need that kind of physical distancing and you cannot get it because people will have to support you all the time, what measures are we putting in place? Do we give you access to PPEs, so that even in their violating the physical distancing rule, you get some level of protection? I think that we should put in place specific measures for people living with disabilities. We have put in wash your hands, keep physical distancing, sanitize your hands, put on your face masks, and left it as if everybody is able to do it. What if they don't even have their two hands to be able to put on the mask? What happens? Somebody puts it on for them, and then one next. You see, so we would have, as a nation, have to draw a separate protocol for people, tailored to people living with disability, and make sure that they are also protected.
But Dr. Uswenchi, these are very stressful times for most of us. We're trying to be careful and stay safe. We've got loved ones. Sometimes some of them may fall ill. How do we support such persons? How do we take care of ourselves and then also take care of others?
No, so for you to be able to take care of others, you need to be well yourself. You need to be psychologically stable and strong. You need to be physically and economically strong to be able to take care of others. But whenever you think about not just yourself, you think out of the box and you think about the vulnerable in the society, in itself, it is emotionally rewarding. It is in itself can psychologically make you strong. The thought that you offered some support to others. And so if we know of any people living with disabilities close by, let us think about them. Whenever you are going to get your nose masks, whenever you are going to get your hand sanitizers, whenever you think of, let me get a Veronica bucket for in front of my shop or for in front of my house, let us think of these people. Sometimes the mere provision of their daily food is difficult. Some of these people beg by the roadside. And now in the documentary, they said, if you are not even in your mask, nobody wants to give to you. So they may go back home hungry. I saw one particular man who has a family, and it was sad to realize that a whole family depends on the begging of this man. A whole family, 2 children, I think, and a wife, depends on what this man brings home. So if this man goes out there and people say that you are not in nose mask, so I'm not going to even roll down my glass and give anything to you, it means that a whole family, including children, are going to sleep hungry. Can we find some support for them, some chore, some job that they can do and earn a living for themselves? And until then, can we provide some hot meals for them so that they don't even have to expose themselves out there in the road? These are some of the things we as a people can do. And we don't have to wait for the government to do these. They are our next door neighbors. They live in our communities. each one of us as individuals can collectively do these things, and then we would be solving a greater problem, even as individuals.
We've been talking about the adults. Now that you talk about the dependents, what kind of psychological effects would all of these be having on the children? There was a family, for instance, that said the children haven't even gone back to school. Even as schools are reopened, they're still home.
And that was very sad. We talk about their parents. They are not, because they are physically disabled or they have one disability or the other, it invariably trickles down to their children as well, their families, their dependents. And I can only imagine the kind of psychosocial or psychological distress these children will go into. Think that schools have reopened and my parents or my father will not even be able to send me back to school, or don't have the means to let me join school virtually or by any form of technology. These children may feel neglected. And in fact, that is a form of abuse. Sometimes we think that only beating children up or only sexually abusing them is an abuse. Neglect is considered as a form of abuse. And so, for all you know, as a nation, we are all guilty of neglect or guilty of abusing some of these children whom we know are vulnerable, whom we know are unable to survive in this kind of pandemic. Such children, I am sure that they would be very, very psychologically distressed. They feel marginalized, and it would even affect their academic performance in case eventually they get back to school, because they have stayed away for so long, they have been left behind. Their mates are doing well, their colleagues are doing well, and they probably will be at the bottom of the class. Mind you, it is not all of them who are not intelligent. Some of these children are very intelligent, and if given the opportunity, if given the chance, they can make it in life themselves. They don't necessarily have to follow the pathway of their parents. They don't necessarily have to be one way or the other disabled or disadvantaged just because their parent have one disability or the other. They must be empowered to stand on their own and make a living and achieve the future that they have set ahead of them. And we should get to their aid. Maybe we should organize ourselves and get to bring these children together, psychologically empower them to make it in life, to get back to school, to provide their needs, hot meals, their books, etc., so that they can make it in life.
Another angle is, and I think the same family where the woman talked about the children not going to school because of financial difficulties, also talked about the toll that was having on the relationship, and how families had said to her, why are you still with this person who is struggling to survive himself? Why don't you just leave him? So I guess, the next thing is, what kind of effects psychologically, if any, would the challenges of the times have on relationships?
No, when people are stressed and they are stretched beyond their limit, that is the number one risk factor for all forms of mental disorders. Depression, anxiety are not cases. They are not spiritual illnesses. When people are distressed and they are stretched beyond their capabilities, they are at higher risk of tipping into one mental disorder or the other. And so for such a woman as the one that was in the documentary, if she gets to the point that the family is saying that we told you to leave this gentleman, he cannot take care of you, he has a physical disability, and so leave. If you don't leave, we are leaving you. Forget that you ever have a family. She begins to feel that she has been left on her own. There is no family support. There is no friends, etc. That can build up distress. That can build stress to the extent that if she does not take care and help and support does not come her way, can tip her into depression, anxiety disorder, to the extent that she will feel that, well, I want to stay in this relationship. This is a man I love. I have 2 children with him already. I want to build a family for him. My friends, society, family say that no, I am lost in between. I don't know what else to do. The best way is to just back out. The best way is to just leave. And that is when thoughts of suicide start stepping in. And so some of these pressures from the family can trigger stress to the extent that it can lead to full-blown mental disorders. And we should all be careful about it. If you cannot support her, the least you can do is to just keep quiet, but rather to insist that she leaves this relationship when she has determined that I am going to stay, would rather be detrimental to her mental health.
Just finally, away from this specific issue of persons with disabilities, just before you go, I mean, you've been on our case and we've had conversations with you. Where are we in terms of our mental stability or otherwise in this COVID times? What kind of tips can you share with us? Their colleagues, friends, sometimes they don't necessarily have COVID, but after a while, they kind of complain that I want to take the test. I want to clear my mind. I guess, I'm not sure if it's because they look at the number of cases or sometimes the persons around us who suddenly get COVID. What are the tips that you want to leave with us?
So generally, let us keep to the preventive rules. You know, when you are in an office, for instance, and all the louvers and windows shutters are permanently shut, you are staying in an air condition, you think that these are the people I come to work with and close all the time, so it is safe to take off my mask, maybe eat every now and then. Whenever you hear that a colleague of yours, who probably even sits 3 desks away from you, has tested positive, you will start getting distressed because you yourself will know that you have not stuck to the rules, the preventive protocols to the latter. And so I say that one of the ways to make us psychologically stable ourselves is to make sure that as individuals, we are keeping to the preventive rules. In that way, even if you test positive, you will know that you did your very best. You will know that this was not your doing. It was not because you slacked. It was not because you were irresponsible. And so please, as a people, let us do what we can in our own individual capabilities and in our power as much as possible to keep to the preventive protocols. I am speaking to people living in who stay in the offices because I'm realizing that we tend to enjoy staying in our air-conditioned offices than to allow fresh air in and out some of the times. You know, once in a while, let us open our shutters to allow free circulation in and out and be discomfort or be uncomfortable just for a moment, void of our air conditioning, and allow fresh air in, which would prevent aerosols from accumulating in our space or in our environment. Again, one of the times I have seen that people are very much psychologically distressed is when they have tested positive, they have recovered, and they have to return to work or they have to return to their normal lives. We are gathering a few data that is showing us that the peak of anxiety is when they get the news that they have tested positive, and then when they have fully recovered and they have to return back to work. You may think that, well, you are out of the woods now, so what is the problem? But no, there's that feeling that I am going back to a risky zone. I am going back into the woods, into the lion's den. What if I get it again? And so as a people, whenever we know that someone is recovered, they are ready to get back to work, that is the point to reach out to them, encourage them, grant them some psychosocial support, offer them some psychosocial support, and let them reintegrate back into their normal life safely. Otherwise, the distress may live on for good. Whenever they wake up, they need to dress up and come to work. They are getting palpitations. They are scared. Their heart is beating fast. They are sweating small. It is disturbing their sleep at night and all that. And so those are key pointers that at those key moments when we know somebody has tested positive and we know somebody has recovered and is returning to work on Monday, please reach out to them over the weekend and give them some encouragement that they would be safe out there.
Just to pick on something that you said, so if I've been doing everything right, and and there are some people that they do everything. I mean, they overdo sometimes, if there's a word like that, and they still get COVID-19. Can that also have some kind of effect on those persons? So I'm thinking, what did I do wrong? And I can't figure out what I did wrong.
I have had a lot of my colleagues that I offered psychosocial support to. They say that they are virtually the COVID police in the environment. They are the one telling everyone, put on your masks, wash your hands, do this, keep physical distancing, and yet they get it. And that question of how did this happen cannot get off their mind. Look, we probably have not gotten it yet that the preventive protocols are not to prevent COVID. They are to reduce our risk of getting it. They are not 100% absolute ways of not getting COVID. They only reduce it. And so you could still keep to all the protocols and some way, somehow get it. And that should not let you feel down or let you feel bad that what else did I go wrong? Start blaming yourself. When you have done all you need to do and you still get COVID, be rest assured that you have done your part. You did your very best. You know, it is when you know you did not do your best that probably the guilt is more on you. But hey, the preventive protocols, we should get it, are not to absolutely prevent COVID. They are to reduce our chances of getting it. And so you could be the COVID police in your home, in your environment, and still get it. And when you get it, be assured that many people are recovering. You could also recover. That should not put you down, because if COVID thrives on low immune system, then being distressed and asking yourself so many questions about how come, how did you get it, why me, is a way of stressing yourself, and it will delay your recovery or it can make your condition worse. And so at that point, prevent and avoid asking the whys. That is not the time to get the whys. It is time to concentrate on getting well, making sure that your immune system is up and doing so that you can fight the virus to the latter and recover.
Well, Doc, thank you for the reassurance, really. Thank you for the words that you share with us. Very comforting. I'm very grateful that you could make time to join us.
Thank you for having me.
All right, great. Dr. Ruth Owusu-Antwi is head of psychiatry units at the Comfort Noche Teaching Hospital. And that's our conversation. When we come back, George Addy Jr. yesterday also shared a very interesting feature titled "Cobra in Boots" with us. He's got the backstory. We will hear that here on the AM show.